Now, each year, around 25,000 Kiwis are diagnosed with cancer, and 10,000 tragically lose their lives, making cancer our #1 killer here in New Zealand. Cancer survival rates in New Zealand are not as high as they are in Australia or other developed countries. And healthcare experts suggest at least some of this difference in outcomes is due to the gap in access to modern care medicines. According to the New Zealand Cancer Control Agency, there are 13 cancer treatments for lung cancer, bowel cancer, kidney cancer and head and neck cancer that provide substantial clinical benefit and are funded in Australia but not here in New Zealand. And we want all cancer patients here in New Zealand to be armed with hope and positivity as they go through this battle against this terrible disease. National wants these New Zealanders to stay in New Zealand and to fight their cancer with the full support of a world-class health system. And that's why today we're announcing that National will invest $280 million over 4 years to fund the 13 cancer treatments the New Zealand Cancer Control Agency says provide substantial clinical benefit that are funded in Australia but not here in New Zealand. So how are we going to fund these treatments? Well, recently the government announced a policy to remove the $5 fee for prescriptions for all patients at a cost of $620 million over 4 years. And it's National's view that there are so many health needs going unmet that an untargeted subsidy like that is going to people who frankly don't need it. People like myself or Chris Hipkins. It frankly isn't the best use of scarce health dollars. And that is why National will replace the untargeted subsidy with a very targeted one, making prescriptions free for low-income Kiwis using the Community Services card. Secondly, making it free for superannuitants and seniors using the Super Gold card. And for all others, the total amount that any family would pay for prescriptions in a year will be capped at $100. This change will reduce the cost of the prescription subsidy by about $316 million over 4 years. And the majority of those savings will be used, therefore, to fund access to the 13 cancer treatments, with the remaining savings remaining in the health budget. Prioritising funding for cancer treatments over untargeted prescription subsidies for those that can afford them shows what New Zealand can achieve when health funding is guided by health needs and common sense, not politics. National is committed to improving healthcare in New Zealand. We are going to increase health funding each and every year in government. We will restore explicit health targets, including for cancer treatment times. We will address the health workforce by training more nurses and more doctors. And National will deliver better health outcomes for our citizens. Today, we commit to closing a number of cancer treatment gaps between New Zealand and Australia. I now want to hand over to our Health Spokesperson, Dr Shane Reti, to run you through some more of the specifics. Thank you, Shane.
Thank you. We're interested in lifting the cancer bar, and clinicians have told us that they don't have the tools that they want or that they need to do that. Clinicians have told us that 1,500 New Zealanders die a year for similar conditions where they might otherwise survive in Australia. We want to address that treatment gap. And they identified 20 treatment options with substantial clinical benefit that Australia funds and we do not. Of those 20, 2 they decided they'd never fund. 5 they have already funded, and that leaves the 13 that we're saying today, these treatment pairs that we would fund. We're very excited for this announcement. We want to work with clinicians. We want to raise the bar on what we do with cancer, and we think benchmarking ourselves to Australia, in this instance, first of all, is a very, very good starting place.
Thank you. Thank you, Shane. Well, as you can see, that's our approach to actually making sure we actually start to close the cancer gap versus Australia. But from Medicines New Zealand, the view is that there's up to 1,000 people a year that will be benefiting. Obviously, some of these drugs and treatments are actually about life extending and others are about life saving. And so it's a complex area, but essentially the view is that there'll be up to 1,000 people benefiting a year from these programs. Okay, thank you very much, team. Appreciate your time. Take care.